What is von Willebrand's disease? Von Willebrand's disease is a genetic disorder that is caused by low amounts of the von Willebrand factor. What is the von Willebrand factor? It is a clotting protein in our blood. The disease is named after a Finnish physician, Erik von Willebrand, who first described the condition in the 1920s. Von Willebrand's disease is the most common bleeding disorder in the world, affecting up to 1% of the U.S. population. Von Willebrand's disease has many everyday symptoms, such as heavy menstrual cycles to persistent nosebleeds. The disease can be diagnosed through extensive blood tests, and treatment varies depending on the level of the disease. The symptoms can be quite mild, ranging to severe, depending on the type or level of the disease the patient is diagnosed with. There are 3 main types of von Willebrand's disease: type 1, type 2, and type 3. There is also a 4th acquired type of von Willebrand's disease, and it is not hereditary. Type 1 von Willebrand's disease is found in 60 to 80% of patients, and the symptoms are usually pretty mild. The symptoms can be nosebleeds, easy bruising, heavy menstrual cycles. Type 2 von Willebrand's disease is found in 15 to 30% of patients, and type 3 von Willebrand's disease is found in 5 to 10% of patients. The symptoms of these 2 types can be more moderate to severe, and the excessive bleeding episodes can be very life-threatening. The 4th type of von Willebrand's disease is acquired in adults after a diagnosis of an autoimmune disease, such as lupus. It can also occur from taking certain medications. The type of von Willebrand's disease is determined by a series of blood tests performed by hemophilia treatment centers. Diagnosis of von Willebrand's disease may be lengthy due to having to repeat testing multiple times. The main test done is the von Willebrand factor antigen test that measures the amount of the von Willebrand factor in the blood plasma. Patients with von Willebrand's disease typically have less than 50% of normal von Willebrand factor in their plasma. After von Willebrand's disease is confirmed, a test to determine the exact type will be performed and determine how it will be treated. The treatment for von Willebrand's disease depends on the diagnosis and the severity. The main treatment is to administer a medicine, DDAVP, or a desmopressin acetate, a synthetic version of a natural hormone, vasopressin. It stimulates the release of the von Willebrand factor from blood cells. There are a few clotting factor concentrates that are rich in the von Willebrand factor and are recommended for patients with the von Willebrand's disease. These concentrates are given to patients via intravenous infusion therapies. There are many other treatments for the von Willebrand's disease, but there is no cure. Von Willebrand's disease is considered the most common blood disease in the world and one of the most treatable. Von Willebrand's disease is classified into 3 types and a 4th acquired type that is not hereditary. Diagnosis of this disease can be a lengthy process due to having to retest patients multiple times. Although the disease is treatable, but it is not curable. Von Willebrand's disease affects up to 1% of the U.S. population, but most symptoms are pretty mild, which could be why it is not as heard of as diabetes or heart disease. Prior to the 1920s, von Willebrand's disease would have most likely been grouped with hemophiliacs. But the discovery of the von Willebrand's factor brought the disease to light. All of this info in this speech was found on the hemophilia.org website. Thank you very much.